Well, good evening, everyone, and welcome to our free webinar series. As tonight webinar is all about finding the right medical director and what every aesthetic practice needs to know. As Dr. Lev Greenman, co-founder of Doctors for Providers, will help you explore the essential role of a medical director in aesthetic practice and why the right fit matters. But before we get started, Empire Medical Training has been a trusted resource for medical professionals for over 27 years and counting. Our purpose is simple: to empower clinicians with the training and support needed to confidently expand into new procedures. Our commitment goes beyond education. We're here to help you grow professionally and safely with a great pathway for your career. We offer trainings nationwide, programs focused on safe, effective clinical practices. Attendees can receive continuous post-training support, including live faculty sessions. You can choose between in-person, virtual, or hybrid learning models, and you can have access to membership packages that create an in-depth educational plan for your growth. Empire Medical Training offers a collective of trainings academies designed to comprehensive professional development. These are structured to meet the needs of medical providers, combining clinical education with modern learning methods. Whether you are entering a new specialty or strengthening existing skills, our academy provides a clear guided route to become a more confident and capable practitioner. As a quick reminder, this is how you are going to use the Zoom. You can submit questions using the Q&A box, or you can also use the chat box to engage with other attendants. Let's make this a productive and engagement webinar. And with that being said, please welcome Doctors for Providers.
All right. All right, everybody. Hopefully you're able to see my screen okay.
Yes.
Today, just to introduce myself, I'm the founder of Doctors for Providers. We've been around for a little bit over 5 years, and we specialize in matching a wide range of providers, including those in the aesthetics industry and also different types of practices with experienced medical directors, and we also match advanced practice providers with collaborating physicians. All right, so what are we going to talk about today? We're going to talk about aesthetics, and specifically, we're going to talk about medical directors. I'm going to touch upon a couple of points. One of them is going to be why physicians matter in aesthetics. We're going to talk about legal and compliance considerations, common mistakes that practices make, what you as a provider in aesthetics or you as an owner of an aesthetics practice or med spa should be looking for in a medical director. And finally, I'm going to talk about how my company, Doctors for Providers, and all of our friendly staff can support you for in being successful and compliant. So the aesthetics industry has obviously grown quite a bit in the last few years. And I think that's why you guys are here. In the last 5 or so years, as you can see in the numbers on the bottom, the industry has grown by leaps and bounds. In 2010, and this data was sourced from AmSpa. This was published in 2024. In 2010, there were only approximately 1,600 locations nationwide that were providing med spa services. And in 2025, there were over 10,000, probably closer to 12,000. So that's a 7,000% or 700% growth in a short period of time. And at this point, the popularity of med spas continue to grow. For that reason, there's been more regulatory scrutiny on the parts of the states and the boards and other organizations to make sure that things are being done compliantly and safely. Patients are always expecting to be taken care of well and are looking for safe outcomes. And so this is why clinical oversight is so important. So I'm not an attorney, I'm a physician. However, I want to define what it means for something to be called medical. And in this case, why is a spa being called medical spa or med spa? So if any service requires medical judgment, and this is sort of a 5,000-foot view, if a service requires medical judgment, prescription authority, or medical delegation by a physician, then legally it's considered medical. Even in instances where it's performed by an experienced provider or practitioner, such as NPPA or an RN, it still falls under the umbrella of medical services. And so if we go and look at the types of services that are being provided at a medical spa, let's look a little bit further and see what are the examples of procedures that fall underneath the umbrella or within the umbrella of medical in a spa. And so some examples include Botox, fillers, laser procedures, microneedling, IV therapy such as IV hydration, prescription weight loss medications that could be the classic stimulant medications and the ever so popular GLP-1 drugs. Finally, PRP and regenerative treatments are also considered medical. I'm briefly going to touch on corporate practice of medicine, also known as CPOM. And CPOM by itself can be an entire lecture, and maybe I will do this as an entire topic at some other time. But because it's an important concept to know, I just wanted to briefly touch on it on a slide. There are state-specific rules on who can own a medical practice or a med spa. And in states that have CPOM corporate doctrine, the professional entity structure needs to be developed. So you need to have a professional corporation or professional limited liability corporation in place. This is applicable to about half the states in our country. As an example, some of the big states that this pertains to is Texas, California, and New York. And again, in these instances, the physician must own the professional corporation. However, just because a physician owns the professional entity doesn't mean that a med spa or a business that wants to be in the med spa space cannot operate. So the way that you make that happen is with something called an MSO-MSA structure. Essentially, the med spa operator becomes a management company or manager of the professional practice, and the manager is known as the Management Services Organization, and the MSA is the Management Services Agreement, and that is the contract that is formed between the manager and the professional corporation. Services in this setup must be billed through the professional corporation, meaning if you're collecting money on behalf of patients for medical services or med spa services or aesthetic services that are being overseen by a physician, that money must flow through the professional corporation. The management services company will then bill fees or administrative fees for what it does or administrative/management fees from the professional corporation, and that's how it's able to collect money out of the PC. Now, I always like to talk about a couple of different compliance considerations and what I think is the best rule of thumb for somebody in a state that has CPOM doctrine. Number one is that licensed professionals who are providing medical services, for example, the medical director or a physician if they're on site, a nurse practitioner or PA or an RN, anybody that's involved in touching a patient or overseeing the care of a patient should be contracted or employed by the professional entity, meaning they get their paycheck from the professional corporation. The other thing that I think is important to discuss or mention is that it's best to avoid something called umbrella PCs. There are undoubtedly several services or independent physicians out there who want to work with as many aesthetics practices as possible. So what they do is they create a professional corporation in a particular state and then have all of their clients or med spas or management companies work under the same PC. While in practice, in the short run, that may be more financially beneficial and maybe more affordable because there's less fees or the fees can be split among different management companies. There's also one significant risk of setting it up under one PC, and that is if one med spa gets in trouble. Let's say they're non-compliant and they get shut down by the state. The state may also go ahead and shut down the entire PC. And if the PC is shut down, you are no longer able to practice. And so there may be one bad character can spoil the entire PC. And so my rule of thumb is to always have a one PC to one MSO structure. Let's talk a little bit now about supervision requirements specifically for advanced practice providers. For NPs and PAs, there is something that you guys are probably aware of, and that is collaborations or collaborative agreements. This is different or separate from medical directorship. So just because a physician is overseeing your clinic as a medical director does not automatically mean that they're also a collaborating physician with the NPs within that practice. So it's important to make sure that if a nurse practitioner or PA is in a state that requires them to have a collaborative agreement with a physician, that is in place before they start practicing. Many times, collaborations also require chart reviews. That is mandated in most states where collaborative agreements are in place. And there are also delegation rules for injectables and lasers, which I'll delve into a little bit more in the next few slides. And it's important to know your state-specific rules because the rules for collaboration and delegation vary. And so, again, it's very important to know, do you have to file with the state when you have a collaborative agreement? Do you not? What's the number of charts that need to be reviewed? Is it 10%? Is it 20%? Does the physician also, sometimes depending on your state, may have to meet with you once or twice a year? So those are all things that you need to know. And in certain instances, if you're prescribing medications, there may need to be a delegation for prescriptive authority to allow the advanced practice provider to prescribe certain medications. It may be all medications, it may be controlled medications. So you really need to know what the rules are before you start. In addition to that, in some states, there are limits on the number of providers, either total number of providers or full-time providers that a physician may oversee at once. So you may want to work with a particular physician and they say, sure, I can be your medical director. But it's also important to know that if your med spa has advanced practice providers that need a collaborative agreement, it's important to know whether or not that physician has room to take on more providers, and they may not, in which case you may need to then work with a completely different physician to be your medical director. So that's a consideration that you have to be aware of before you sign up with a particular medical director who's also willing to be your collaborating physician. And again, there are state-specific documentation standards for collaborations. I wanted to mention 3 specific states that have very unique rules that make it sometimes challenging for med spas to effectively find a good medical director. One of the best examples of this is Florida. Specifically when it comes to aesthetics practices, and that in Florida is defined as a practice that is more than 50% skincare, and where there are skincare services that must be rendered by an advanced practice provider. Those providers have to be overseen by very specific types of physicians. In Florida, those physicians are in 2 classes. They're either board certified or board eligible dermatologists or plastic surgeons. And there's just not a lot of those, people around. They exist, but that's what you need to look for. In addition to that, there are geographic restrictions in Florida. A physician can only have 2 offices that they oversee. One of them must be their primary practice, and the other location, and they can only have one other location that they oversee, has to be within a 75-mile radius or distance of their primary location. So that makes it quite challenging sometimes to find a good fit for your medical director. In Texas, there are specific rules for laser hair removal. The physician has to be in the same state as you. So not only do they have to be licensed in Texas, and basically as a rule of thumb, the physician who oversees care, whether that is as a medical director or collaborating physician, always has to be licensed in the same state as where the care is taking place. That's where, essentially where your patients are, your clients that become patients. If it's in a med spa setting, the doctor has to be licensed in that state. That can also become challenging if you are prescribing, let's say, and you have clients who travel between states. Let's just say you're in Florida and you have clients who go up to New York in the wintertime. Well, if you're going to be providing care virtually with these patients, you can only do that if the providers that are giving care are licensed in both states or in the same state where the patient resides at the time that they're being seen, even if it's virtually. And really the same should go for your medical director and or collaborating physician. But going back to Texas, in this case, in this instance, if you're providing laser hair removal, the physician who's overseeing it has to be in Texas physically. Also, that physician must be reachable immediately by phone. There have to be clear escalation protocols. There needs to be an ability to intervene if serious complications arise during the treatment. And of course, there also have to be periodic chart reviews and quality oversight. Finally, the third state that I wanted to talk about is Iowa. Iowa has a very specific state restriction, and that is a medical director who delegates medical aesthetic procedures to a non-physician has to be at all times within a 60-mile distance from the medical spa. So the physician really cannot travel outside of that if they're going to be supervising you. So let's talk about why you need a medical director. There's a couple of different reasons. I mean, there's obviously the regulatory compliance. That's the laws say you need a medical director. You want to mitigate risk, and that is both the compliance risk of following all the rules, but also the patient safety should also be your top priority. And so you're mitigating the risk of patient injury and being on the good side of the law. And finally, it's professional credibility. When patients come to you for aesthetic services that require medical oversight, they want a credible medical director. They want to make sure that that medical director is involved. And so these are all the reasons why a medical director is important. What are some of the risks and liability exposure for an aesthetics practice? Well, if things aren't being done properly, there's malpractice risk. If a patient gets hurt during a procedure, they can sue. They can sue you as the provider, they can sue the med spa, and they can sue the medical director that is overseeing the care of the patient. Board investigations can happen if there's improper oversight. I have seen many complaints, or heard of many complaints of improper supervision, and these complaints, unfortunately, can come from many different directions. It could be an unhappy employee. It could be a patient who doesn't feel like things were not done appropriately. It can even be a competing medical spa that exists a couple of blocks away from where you are. Hey, they don't like competition. So they may go to the medical boards or some other agency and say, hey, I don't think the med spa down the street has proper physician supervision. And when these complaints come into the proper medical board or nursing board or whoever's overseeing that particular medical spa, they have to take it seriously and they have to investigate. So if you're ever investigated, that doesn't mean you're doing anything wrong, but if you are, you obviously want to make sure that you're doing things compliantly. And finally, insurance implications can mean there could be an effect if you accept insurance, which usually isn't the case in med spas, but let's just say you prescribe medications or certain things that can go through patient insurance. You may not be eligible to accept insurance if you're doing something wrong. And finally, just the cost of your malpractice insurance and even general liability insurance will go up over time if there are claims against your business and or practice. So it's financially detrimental not to be compliant. What are some of the common mistakes that a med spa can make in choosing a medical director? Well, the first one I think is choosing the lowest cost option. As is true with many things in life, you get what you pay for. Some physicians are just there to, potentially make a little extra money without wanting to do the actual work. And so they may be okay with you putting their name on the protocols or putting you on their website, but they may actually not know anything about how a med spa runs, or they may not want to be available for emergencies and may not be able to advise you properly about what's going on, may not want to do chart reviews, et cetera. So just because somebody's willing to be a medical director doesn't mean that they're a good medical director to begin with and should not be chosen. Other mistakes could be lack of formal agreements in place between you and the medical director. Again, the medical director may have very minimal involvement, which should not be the case. Med spas may ignore state-specific compliance rules. There's no ongoing oversight or audits by the physician. And I also think it's important to note that I personally think it's a mistake not to work with a healthcare attorney. Now, we all know attorneys can be expensive. However, there's a reason why they're expensive, is that they can save your butt on a rainy day. And I think that is very true for med spas, is that a little bit of advice from a healthcare attorney, review of a contract, or oversight of the processes of your med spa can really go a long way in making sure that you are being compliant. Well, we talked about red flags and things that you shouldn't be doing, but what about what you should be doing? Like, what is the right medical director and what should they be providing you if they're a good fit? They should have active oversight and availability. If you need them, they should be a phone call away. They should be involved in protocol development and review of old protocols. They should want to and should be doing chart reviews and QA processes with your staff. They should be educating your staff and potentially doing some training. There should be an overall collaborative relationship with your med spa. And ideally, or almost always, they should bring experience in aesthetics with them. They should be experienced in the procedures that you guys are performing. On the other hand, there's some red flags to avoid in a physician. Again, doctors who have no involvement, instances where there is no malpractice coverage clarity. What do I mean by that? when you're providing medical services, you should be covered by malpractice insurance, which we all know is not cheap. It's also important to note that the medical director, even though the medical director may never touch a patient if they're remote, they also need to be covered by malpractice policy. They either need to bring their own coverage or you need to add them to your malpractice policy. So in case there's ever a lawsuit, everybody needs to be covered by insurance. Nobody ever wants to be personally liable in a case. So you also want to avoid any vague contractual terms with your physician. It should all be very clearly laid out. And finally, when there's no defined scope of responsibility, meaning every provider of medical services should have a very clear role in what they're doing and how they're supposed to be doing it. And the doctor who's overseeing the practice, the medical director, should be signing off on the scope of responsibility of those providers. Some things to just, rules of thumb, some things to consider in general. So for example, if you are an injectable only med spa, you may want to work with a physician, or you should work with a physician who has experience with injectables in aesthetics. If you're a laser focused practice, again, you should be working with a physician or medical director who has experience overseeing lasers, and in certain states have to be present, not too far away. If you're a multi-provider clinic, the doctor has more responsibility. So you want to make sure that the doctor is still willing to review a certain number of charts per provider and be able to potentially be more available, because there's potentially more questions that are going to be asked when there are multiple providers in the clinic. Finally, multi-state expansion. If you're doing really well, you want to move to an adjacent state or some other state to open a med spa there. Again, you have to remember that your medical director has to be licensed in every state where you practice or that they're overseeing. And again, the collaborative agreements may come into place, and corporate practice of medicine rules may also apply. So there's a lot of things to consider when you're expanding. Another good reason to have a good healthcare attorney when you have that plan. Okay, well, what should you ask yourself and potentially the medical director before you start working together? Okay, number one, again, is the structure compliant in my state? Is everything we're doing and the way we're going to be supervised compliant based on state rules? Is the malpractice coverage clarified? Is everybody covered? Are the providers, is the practice, is the physician covered in case there's ever a malpractice suit? How accessible will the physician be? Again, they should be available to answer questions and potentially do some training. So depending on your level of experience, depending on the volume of patients that you're seeing, you need to know how easy is it for you to be able to reach the physician, and you should have that physician's name, phone number. It shouldn't be, just somebody you email once in a while. It really has to be somebody you can talk to on the phone or even do a Zoom with. And finally, are there written oversight protocols that are signed by the physician, et cetera? All of that has to be done and considered before onboarding your physician. The importance of specialty and experience alignment. So essentially, we've already talked about Florida. As we discussed, practices with more than 50% skin care have to be overseen by specific specialists, dermatologists and/or plastic surgeons. If you're not in Florida, you still will want to work with a physician who has experience in aesthetics. The doctor needs to be comfortable delegating procedures. And of course, they should also understand the cosmetic patient care in general. Compliance first approach. You should always be aligned with any state requirements. You should always have structured agreements. There should be clear delineation of responsibilities, again, of who's doing what and how. Everything should be documented appropriately. The physician really should be doing chart reviews and overseeing. If you have standing orders in the clinic, the physician really needs to oversee that, write those orders, be responsible for the flow of how things are being delivered when you can do standing orders. Why is it important to have a personalized approach when trying to find your medical director? Not one size fits all. Just because somebody's, again, if a physician's willing to be a medical director or can oversee lasers, doesn't mean they may be able to oversee injectables, and vice versa. You really should focus on finding a doctor that can help you grow, and both of you should be able to grow together with, as time goes on. So it should be a long-term relationship. So if you do everything correctly from day one and you're aligned in how you see things progressing, that will allow the relationship to continue, hopefully for a very long time. And finally, there should always be emphasis on compliance and sustainability of your processes. Okay, so what are some of the key takeaways for what we've just discussed? The right medical director will actually protect your practice. Compliance is not ever optional, it's mandatory. Structure and oversight really do matter. Strategic matching will create long-term stability. All right, so right now I'm going to shift gears a little bit and talk to you about my company, Doctors for Providers, and how Doctors for Providers can help you find a new medical director or replacement medical director, or medical director you never thought you needed, but you do. So where does my company come in? What kind of experience do we have? As I mentioned earlier, we've been around for over 5 years. We have over 5,000 physicians in our network. All of these physicians have been vetted, and many of them have experience in supervising aesthetic procedures. We have helped over 2,000 providers to date, and we pride ourselves on being very reactive and responsive to our clients. And we always try to provide not only personalized service, but to answer any emails and any new requests within 24 hours. Typically, all requests will be answered the same day. Some of the things that make Doctors for Providers unique, and I think advantageous to potential providers or med spas or aesthetics practices, is a couple of things. Number one, we do not charge any upfront matching fees. What does that mean? That means if you want to find a medical director with Doctors for Providers, or you need a collaborating physician with Doctors for Providers, you do not have to pay us anything until you start working with a physician. So you're going to be introduced to a physician, you're going to have a meet and greet or a video call with that physician, and until you approve that physician, you will not be charged anything. And we may do a lot of work in finding you the right physician, but we're not going to charge you anything for that. Another important thing that we offer is malpractice insurance. As I had mentioned, everybody who provides medical services, including the medical director themselves, have to be covered under malpractice. So what we have is comprehensive coverage for our physicians. So in most circumstances, in most medical directorships, and in most collaborations with advanced practice providers, our physicians already come in with malpractice coverage that's offered by us, and you don't have to pay for it. You don't have to add them to your coverage, and that can save you a significant amount of money. We also offer complementary collaborative practice and medical directorship agreements. Again, we're not attorneys, but we do have sample contracts that you guys can look at and utilize with your medical directors and collaborating physicians. As I had mentioned, we do virtual introductions to your doctor. So you're not being blindly matched with somebody. You're actually going to look this person in the eyes. You're going to ask them questions. You're going to see if their attitude or their approach matches what your philosophy is. And you're going to be confident that the connection is good. We also mitigate your risk if something doesn't work out with your current medical director. Let's say your medical director becomes sick is unable to continue to work with you, or you're simply not happy with what your medical director is doing. Maybe they don't have the right amount of time and they're just not giving you what you need. Well, if you are working with Doctors for Providers and you come to us and say, hey, I need a new medical director, we will find you a new medical director. We'll make our best effort to find you a new medical director, and it's not going to cost you anything. Finally, we also provide sample protocols for IV hydration, med spa in general, and medical weight loss. So if you want to utilize them, there's no additional cost. The next couple slides are actually taken from our website at doctorsforproviders.com. And a few of them, they do rehash some of the information that I already gave you. Again, I think it's important to talk about. The malpractice is included. We have templates for, if you want to use them, for compliant, structure of your contract with your medical director. We do the pre-engagement consultations or the video Zooms with your physician or potential physician. We will try to replace your physician if something's not working out. And we have materials for you to use, protocols for different services that may fall within your scope. A couple of other things that I've already briefly touched on: no search fees. You're going to be connected with a medical director who is going to be experienced with what you're doing. And we're going to also be able to match you with medical directors in non-corporate practice of medicine states and corporate practice of medicine states. We can find you just a doctor to be the owner in a CPOM state, or both the owner and the medical director. It really depends on what your needs are and what the best fit is. We can do that. Finally, you're free to connect with us through any social media platform. We're pretty much on all of them, or you can go to our website. These are clickable links if you have access to the presentation afterwards. If you want to register with us, if you're an Empire member, I believe we are located on the portal somewhere, and you can register right there. Or if you're not an Empire member yet and you're browsing the web, go to doctorsforproviders.com. That's either FOR or the number 4, goes to the same place. And you can schedule a free consultation right there and then. And you're going to meet your dedicated account coordinator, who's going to be pretty much holding your hand and making the right connection for you.